move into the KUAM News Zoom room. The sanitizing duendes are moving very quick. There's a lot of traffic going in and out. Please mind your distance. Please mind your distance. And we're back here with the hospital administrator, Lillian Posadas. Good morning, Lillian. Thank you for your time.
Good morning. Good morning, Guam.
Let's just get right into it. Could you update us on the COVID census, Guam Memorial Hospital? I saw that it's doubled in the last week. The number of hospitalizations has gone from 27 to, I think, 50. So where are we this morning?
52. We have again picked up, yes, several admissions yesterday. I think about 8 admissions yesterday. So, yes, it's picking up again. People are coming in with the symptoms of, respiratory fever, and so they're getting admitted. Of the 52, 12 of them are at the ICU level of care, and of the 12, 4 are on ventilator support. The total census in the house, not just the COVID that's picking up, but also non-COVID, our total census, combining both COVID and non-COVID, we are at 152. So it's kind of like, pre-COVID, our numbers. So, yes, it has picked up.
What happened? I thought GRMC was going to be the non-COVID hospital.
They are, and they're also, their census is picked up themselves.
Wow.
So, both hospitals, we are busting at the seams. So, people are sick.
You run out of beds yet? Are you close to it?
Well, we still have some open beds. And so,
Some, like 10?
What's that?
How many open beds do you have? I mean, what's the maximum
Well,
capacity?
we still have on the surgical floor, medical surgical, telemetry. We've maxed out our capacity for telemetry beds. We still have some beds in the Care 3 and Care 4. So
roughly how many?
I don't have the count right now. I have to go back into my calculator and get you the numbers of how many are open,
Right.
how many are available.
Lillian, Dr. Hoa was on again this morning, and something that he's kind of reiterated all week is that people are waiting too long to go to the hospital.
Well, as much as we try and encourage them to come, I'm sure there are some reasons as far as, hesitancy to get the treatment for whatever reason. I'm sure there's a variety of reasons, but we try and encourage them to come as soon as they can. We just want to make sure that they know that, services are available here at the hospital for them to be seen. If they're not able to go to a clinic, a private clinic or public health, services are available if they need to be seen and treated. We want to give it that, we want to give them that assurance that, they will be treated, they will be seen regardless.
41-year-old COVID-related fatality early yesterday morning. Lillian?
Okay, what's that? Here at GRMC.
What was that?
Can you tell
I
us?
don't remember.
Yeah, just if you could just give us any additional. I know I always ask for any additional information on COVID-related fatalities in the last day. Do you have any?
I can't even remember anymore if we had one yesterday. I don't think we had one yesterday. I believe that was GRMC's. Right. So I don't have any information. I have no idea.
Lillian, I'm just on GMH's website, and it says that Guam's only public hospital with a licensed capacity of 158 acute care beds. Is that accurate?
Mm-hmm. Well, we used to think we were at 161, but the numbers are kind of changing. So with the Medicare certification, we were at 161 bed capacity. That was our certification. So how it gets changed, I guess I'll have to go back into check with our operations administrator.
Mm-hmm.
How'd that change to 150 what?
I'm just looking at your website. It says 158.
Okay. Is that the updated website?
I'm not sure. I just Googled Guam Memorial Hospital, popped it up, and then I got 158. But if you're saying that you guys believe it's 161 and you're 152?
161 is, right now our census is 152, correct?
Right.
That includes all of the, the MCH, the nursery, babies that we are that are in the hospital. So that's counting all the patients, inpatients, including newborn.
Lillian, when you come on and we ask about, bed space and all that, you routinely bring up the point that it's not necessarily about the number of beds, it's about the number of staff to take care of the patients in those beds. So where are we with staffing?
Okay, well, we have the 39 RNs from New West. We also have now, I think, 12 or 14 from the other staffing solutions agency that we have contracted since 2018. So we have additional staffing, but again, we're stretching our own organic staff. So because we lost some of our own organic staff, and I mentioned it before that from the onset of this COVID in March to September, we lost 20 registered nurses. And although we are recruiting some nurses, and again we lost some more nurses just beginning of this month through retirement. Some of them have chosen to go ahead and retire. So we've lost several more nurses. So yes, we are challenged with our staffing situation.
Lillian, the Dr. Ho also said that we're not going backwards. So this is where we're at, this version of PCOR 1, where you can gather up to 5, you can go around and do all these things. That being said, we continue to see a spike in hospitalizations. If we don't do anything to slow the spread of the virus, as far as like tightening restrictions or anything like that, when do you anticipate GMH will burst at its seams? Because you're already close.
She said they were.
Yeah.
We're already busting at the seams. Both hospitals, we're full. We've got lots of patients, but we just have to continue to manage. And at the same time, the doctors are doing their part, that if the patients are stable enough and then can be released, discharged home, it's an ongoing revolving door. That the doctors are working with us to determine if these patients can safely be discharged home. So,
Right. So
yeah,
you,
it's a
so you guys are,
continuous cycle.
yeah, you guys are bursting at your seams. Are you guys anticipating opening an alternate care facility?
The alternate care facility that has been established is the fifth, the skilled nursing facility up in Barragán Heights. And so we are going to start moving patients there today.
Okay. So, how many people are you guys planning on moving up there?
Well, the doctors are looking at, they're still assessing the patients, and so some already have been identified. Those who are very stable, who are on low flow oxygen, close to being discharged home, but still need to be managed with observation. So the doctors are looking at the census, and we're going to start today, possibly looking at 4 today for now. And a gradual progression of getting them in, getting them settled, getting them stabilized. And so we are looking at 4 on the list for now.
These are COVID patients, right?
Correct.
These are COVID.
Because that's what that facility is for. It's for COVID isolation
Isofac.
overflow.
Okay.
Right. That's what it is. It's an isofac.
But this is something you guys will probably be doing every day because you're
We're gonna
bursting
be
at the seams over there.
Yeah.
Was it open because you need to relieve the pressure that's happening at GMH? You need the space to be able to bring in more people. Is that
That's one of the reasons why, so that we can then, we need to continue decompressing here, so that as patients come in, we can then make sure that we can get them into a room.
wow? I'm really shocked. I'm hearing it's opening as many times.
She's been
It's
asking about it
actually-
since March.
It's happening.
Yeah.
Oh my goodness.
Well, and we've been wanting to
Yeah.
make it happen. It's just so many other things are going on that takes priority. So we keep switching lanes here.
What about the transfer of patients? Do you have enough personnel to do the critical care transports?
What was that again? Say that.
Is doing the critical care transport from GMH, is that going to present any problems? Do you have enough personnel to do that?
We have our medical transport. We're not going to tie up the ambulance, the GFD, because they've got their own mission to respond to emergency calls, and they're still getting called for to go to the homes to pick up individuals who need to be taken to the emergency room, whether it's GMH or GRMC. We don't want to tie them down from their mission. We have our medical transport service plus our patient couriers who are certified and are licensed to drive the vehicle and contain the individual still who needs to be in isolation.
Lillian, in closing, we just got a comment here. Frontliners need our help. We need to stay home. What's your message to the people of Guam?
Again, to continue, please continue wearing your mask, because science, we know already from science and from CDC that it's airborne. It spreads, and it can spread further than 6 feet. And this virus can linger in the air from minutes to hours. And so keep your mask on and keep your distance from people especially people you don't know. Because, this virus, like I said, it's very deceptive. It can jump into your system, into your, breathing system, and you can get infected. So protect yourself, protect your family. Practice wearing the mask. Oh, no, really wear the mask all the time as much as you can. And social distance.
Thanks, Lillian.
Thank you, Lillian. We'll
Thank
let
you,
you get
too.
back to work.
Okay.
All right.
Stay
God bless
safe.
you. Stay safe.
Everybody.
Wash your hands. Okay. It's 9:02. We'll take a quick break, and we'll come back and discuss the vice presidential debates with Phil Leon Guerrero and Sean Gumatau. And then we'll jump into